Consider Cannabis is not intended to be a substitute for professional medical advice, diagnosis, or treatment recommendations. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
It's mind-blowing to me. Like, if they're concerned about the effects that cannabis has on the young brain, I want them to look up the studies on the brain shrinkage that antipsychotics have in our kids, the mortality rates. I want them to look into that and then compare it to cannabis. And then we'll see what's safer.
It's time to consider cannabis. I'm your host, Curtis. This is the 25th episode of Consider Cannabis, and it's a special one to me. This topic this week hits closer to home than any episode to date. Now, last week we talked about the cannabinoids, and I gave you a personal medical update. And if you follow me on Facebook, you've probably seen that I've recently been referred to a surgeon to go over the MRI of my neck. And I'm going to keep you guys all up to date on that kind of stuff too. But this week's guest is Tiffany Carwile of MAMA, Mothers Advocating Medical Marijuana for Autism. Now, I don't know if you have been keeping up with Ohio news, but the Board of Pharmacy just voted down insomnia, depression, and opioid addiction as possible qualifying conditions, and they postponed the vote on anxiety and autism. They cited the reason for postponing the vote as them just getting 2 new board members and having a wealth of information for them to go through, and, quote, there being no rush, end quote. Our guest this week, Tiffany Carwile, would disagree. Now, me, I'm always a skeptic. It's just who I am. It's in my nature, especially when it comes to the latest and greatest treatment for autism. But when I tried CBD, I was totally impressed with what it could do for me. And when I heard what it could do for people with autism, I wanted to try it. But CBD from hemp, while technically isn't illegal, it technically isn't legal either. So I'm just left in this really weird gray area of frustration where I've heard that this plant can do great things for my son, but I'm scared to do anything about it because I'm a medical marijuana patient and I have THC in my system. If they tested my son and found THC in his system, I'm pretty sure they'd probably take him from my custody and say I'm not a fit parent. So I'm left with the frustration of knowing that I've heard success stories with kids with autism and cannabis, but I'm left wondering. So if that has piqued your interest at all, let's sit down with Tiffany Carwile of MAMA and we'll consider cannabis together. So what can you tell me about MAMA USA?
MAMA USA stands for Mothers Advocating Medical Marijuana for Autism, or MAMA. We are a grassroots education group whose primary goal is to empower parents to advocate for their children with autism. Autism affects 1 in every 59 in our country and all over the world. And it's actually projected to honestly be closer to 1 in every 40 now, because a lot of the statistics that they pull, they only do certain studies on age brackets. A lot of autistic adults and so on are left out. So they're actually projecting it to be closer to 1 in every 40, even though the CDC says 1 in every 59. It's kind of hard to map autism because it's so expansive and prevalent at this point. No medications can cure or treat the core symptoms of autism. And those core symptoms include abnormal development of cognitive skills, unusual response to sensory stimuli, behavioral difficulties, hyperactivity, short attention span, impulsive behavior, aggressiveness, self-injurious actions, and so on. Autism is a severe long-term developmental disability, meaning lifelong. It is a lifelong condition. There is no cure for autism, and it greatly affects the cognitive ability, physical functioning of the individual diagnosed, including their ability to reason, problem solve, plan, exercise judgment, and learn. Now, like I said, MAMA was founded back in 2014 to address this growing epidemic of autism with therapeutic cannabis as a safe, affordable, and effective medical option for autism spectrum disorders, not just in specific states, but hopefully across the US. We just have to go state by state and change laws because each state has different laws and different processes. Some states require you to file a bill. Some states require you to file a petition. Ohio is a petition-based state. We envision that the United States to be a country where families and caregivers of people with autism spectrum disorder will have the freedom to legally access organically grown whole plant therapeutic cannabis in all of its various medicinal forms, including different variations of unhindered ratios of CBD and THC, excluding anything synthetic, pharmaceutical, or genetically modified, because our kids need clean, organic product. Autism now affects over 3 million individuals in the United States, and only a small handful have legal access to medical cannabis. Our organization is about changing state laws so that our children with autism can have safe legal access to this healing plant under a doctor's guidance, of course.
Are you a founder of Mama, or
I'm not a founding member of Mama USA. I am the founding member of Ohio Mama. I started the Ohio Mama chapter. We have various chapters all throughout the U.S. We've actually helped change laws in upwards of a tenth of the country. We're hoping Ohio will be the next state. Amy Falwell and Talia Michelle actually are the founding members of Mama USA. They started this organization in Texas back in 2014, and we have expanded tremendously since then. I joined in 2017.
In 17, how did you get involved with the organization?
I kind of discovered them organically on my own. My son was just freshly diagnosed at the time, and he was having a rough night battling some autism-induced insomnia at the time. Autism was a very new thing for me.
What year was that?
He was diagnosed in April of 2016. This was in 2017 when I discovered Mama. It was freshly after my son was diagnosed. He hadn't even been diagnosed for a year at the time, and I was still learning about autism and everything that it entails. So I was fairly overwhelmed at the time, just learning about everything that comes with the territory of autism. And even though, like I said, my son was born autistic, we were all still learning about his state and his condition and symptoms. And it was about 4 a.m. when I finally got my son asleep, and I stumbled onto a show called Weedakit on the Vice Network. And there was an episode entitled Herb for Autism. This episode was based around Mama USA and the Pennsylvania chapter. And I instantaneously just felt gravitated to the idea of marijuana as a possible method of treatment for autism. And upon watching the episode, I found myself just completely connected to these moms on a spiritual level, as if I knew them or as if they knew me. And one mom actually spoke, coming from a place of regret, about how her son had died from an autism-induced seizure, and her biggest regret was not being able to try cannabis to be able to treat him. That struck a chord with me. Like, I couldn't sleep, not just because my son's insomnia after that, but because her son had many of the same symptoms and behaviors as my son. And that specific segment of the show still replays in my head to this day. And it sparked me to do months of research on my own before I even reached out to Mama USA and just dive into the science behind cannabis for autism and what was out there at the time on my own. And I actually reached out to Amy Falwell, who's the president of Mama USA, and inquired about starting, if there was an Ohio chapter, or how to start one if there was not. And I ended up founding Ohio Mama in 2017, and I have been an active member ever since.
My son was diagnosed in, I think, 2011. And back then it was, I think they said it was 1 in every 104 had autism. Mm-hmm. And I've just been watching that number get smaller and smaller and smaller. So it is really widespread. And I just remember, like, when my son was diagnosed, there's so much stress involved around not understanding what that means for, like, the rest of my life or the rest of his life, you know? And then we got it, our diagnosis was dropped off in a hotel room as we were flying to Ohio. So it was like, I'm really glad we got that diagnosis before we moved, because I didn't realize how hard and how difficult of a struggle that can be for some people to even get an autism diagnosis. But
the night that I discovered Mama was one of my hardest nights with autism, because I was just everything that you said, like my future, my son's future, and my daughter's future. I have a neurotypical child as well. She's 9. Her name's Katie. She's my best friend and my biggest supporter. She knows very well what I do, what I advocate for, and why I advocate for this. And I educate her heavily on this because I don't want her to think of me as a bad person for what I represent and why I represent it. So she is actually probably more educated than people and like teachers and whatnot in her school about cannabis as medicine.
That's awesome.
Because in DARE in school, they teach you that this is bad, this is wrong, this is a drug. And I don't want her to think that I'm a bad person or I'm trying to give my son a harmful drug, when it's always been a medicine first. People look at marijuana as it is this like just big stigma attached to marijuana, like it's this harmful Schedule 1 harmful drug in the same category as heroin, when ultimately it's always been a medicine first. Pharmaceutical pills were just, over the past, a little over 100 years ago, were just becoming mainstream back then. Before that, what did they use? You can see documents of cannabis being utilized as medicine. And a lot of that information has been suppressed until recently, especially within the past 5 years. There's been copious amounts of evidence surfacing as how effective this treatment is, not just for autism, but for a variety of conditions. I would love to advocate for multiple conditions at one time. Trust me, don't get me wrong. I actually live with multiple ailments myself that I could be advocating for, but I know that my life and my daughter's life and my son's life are never going to progress or get any better until my son has access first. So that is my main priority right now, is getting him access, because as you know, as an autism parent, autism takes over about every aspect of your life. And I am alone raising my son. His biological father has nothing to do with him. So getting him in a better state is top priority for me as a parent. And it's my daughter, honestly, is very adamant about anything that she can do to make this happen too. She's actually attended conventions and public speaking events with me to speak on behalf of her brother.
That's beautiful.
It's incredible to me because she wants to do these things. I don't influence her to do these things. She wants to let people know that autism doesn't just affect the person diagnosed, it affects the entire family. And she has to watch her brother suffer and watch his condition worsen over time. And even in her own little 9-year-old brain, she gets how and why this is important.
Mm-hmm. So was your daughter born first or second?
Yeah. She's the oldest. She's 9.
Yeah, okay.
She was born in 2010. My son was born in 2014.
Okay.
There's about a 4-year gap between the two. She's neurotypical, like I said. She's
Silas, our son, he was born first. And so when we had our second child, Cadence, who is neurotypical, and watched her progress in a typical manner, we were just kind of blown away by how much stuff we should have seen, but we just weren't really.
Yeah, see, it was hard for me to accept my son's diagnosis at first because I attributed a lot of his developmental delays to the fact that, okay, well, Katie's a girl, he's a boy, like there's, just all these differences between the two, like they're different children, he's a male, she's a female, so on and so forth. Some of my family members thought my daughter was autistic because she wasn't very social. It wasn't that she didn't engage or, she's always been kind of reserved into herself. She's just like me. And I knew that. And when I brought the idea up to my family, they were kind of all thrown off that Jackson possibly could be on the spectrum. And to me, I don't know how I didn't see it sooner. I think I had my mother's blinders on, is what I like to put it, because you never you look at your child like they're not like they're perfect to you. You know what I mean? And even in all of their flaws are perfect. My son didn't make eye contact for the first year of his life, not even with me. He was just kind of always in his own world and very withdrawn. And I was very inquisitive about that, but I didn't want to accept the fact that it was autism right away. He went through about 1.5 years worth of evaluations before the diagnosis was finally concluded as severe low-functioning autism.
Wow. And
it was the hardest thing I ever had to accept in my life. It's hard for me to talk about even still to this day because it changed everything. Even though I kind of already knew, it was hard to know that because I grew up with a lot of ailments myself and my life was not easy. And I know how that affected me as a child and how people treated me. And you never want that for your kids. You always want your kids to have everything better than you ever had it. And just knowing that my son was going to have a rough childhood and possibly a rough life was just the hardest thing for me to accept, especially knowing that I raise him alone. So I commend you and your wife for raising an autistic child. I know exactly how hard it is to balance.
Not at all. I commend you. Honestly, you amaze me because my wife travels a lot for work. So there's weeks where it's just me and the kids, and I'm just blown away with how much I can't get done. Like I want to get stuff done, and then the time of the day just disappears. And I'm like, I don't know how anybody does this without some support. And I mean, I assume you have some support network in your life.
Assume is a good word because I really kind of don't.
Yeah.
My family is around, but Jackson has all me.
You have people you can call if you get a flat tire and you need a ride to the shop, right?
Maybe. I don't want to sound bad at all. I
No,
love
I'm concerned about you as a human being. Like,
I do everything. I'm mom and dad. I do a lot of everything myself. Autism has completely taken over my life. I was a chef for almost 13 years before I had to step away from my career, which meant the world to me. And I was unable to work outside of the home because my son's diagnosis progressively kept getting worse and harder to manage. Nobody could handle him. And it was just spiraling out of control. No matter what interventions and therapies I would try, we were not seeing progress for him. And it ultimately has taken just about everything in my life, my freedom, my ability to work outside the home, my daughter's freedom, my son's childhood, my daughter's childhood, and then some. I have had to move out of the home that my son was practically raised in into an apartment. And it's just, you never know what in life you really take for granted. Even like the conversation that I would have with my daughter before my son was born, where she would ask me why like 50 times. And I'd be like, oh my gosh, Katie. Now I would kill for that with my son. Now I would kill for the fact to be able to walk back into a kitchen and do what I love to do for a living again. Not that I don't love what I do with mama. Don't get me wrong. This ultimately, my life serves a greater purpose now than it did back then. And I completely love the way that autism has transformed my life in certain ways. In other ways, it has completely robbed me of everything. Not my son. My son hasn't done that. Autism has. But what can start to give us our life and our freedom back is cannabis for autism, and a safe, effective, viable treatment that can help my son progress in life instead of him progressively getting worse. And hopefully, eventually, one day, I can start to reclaim my life and my daughter can have a little bit more of her freedom and her childhood back, because she has already accepted the fact, because she knows full well of my conditions. I have 2 heart diseases, that if I go, for some reason, if she is of age, that she will have to step up and take care of Jax. She has told me that she doesn't want to have kids because of this. That is nothing my 9-year-old should be having to think about. But she's so mature in that way that she knows that it's our reality and Jackson's and mine and ultimately hers. And she accepts that, and she doesn't resent him and she doesn't resent me, even though I live with the greatest guilt in the world, because our life is not anything like it used to be. And she has had to sacrifice more than I like to admit for her brother and for me and for autism and even for this cause. She's had to sacrifice. And I hope one day she really knows how much that I appreciate her and everything that she's done, even though I know she doesn't fully grasp that now.
Yeah. Yeah, that's really hard. One thing I've learned since doing this podcast has become very apparent is that you just get to live life a certain way for 1 minute, and then the next second, your world has changed.
Everything's changed. That's exactly what happened. It seems like even though his diagnosis took a while to happen, like once it happened and it was set in stone, and like it seemed like my entire world just completely flipped upside down. Like, and every day it kept getting flipped upside down in different ways, and new symptoms would arise. And when I thought it couldn't get worse, it would. And
at that point, what was your opinion of cannabis?
I've always been intrigued by the copious amounts of ailments that medical cannabis can treat and even cure. So the idea of cannabis for autism was almost like a no-brainer. When I stumbled across this organization, I was shocked that it didn't dawn on me before, but I was just so overwhelmed by my son's diagnosis as it was at the time. And like I said, I didn't know what all and truly entailed. I didn't know that autism is like an inception diagnosis. It is a condition within a condition within a condition within a condition within a condition, and it varies for each child and each person that is on the spectrum. It is so vast and broad that it can make your brain explode. So
it's so true. Like my son, for example, he does a lot of hand flapping and vocal stimming. He smiles when I call him partially verbal instead of nonverbal. Like he likes that term because he can say some words, but typically it's like very soft and very quiet and very sweet, like whispers. And they're oftentimes like you have to coax him out of him, like you really have to show him he wants it, and he'll run away. He will just go find a water source. I don't know how he just beelines to them, but that's what he does. What are some of your son's symptoms?
It's funny that a lot of what you're saying about your son is kind of relevant to my son as well. He's technically considered to be nonverbal. Not that he doesn't speak. A lot of people don't understand the term nonverbal. When I say my son's nonverbal, they're like, Jackson can say words, Jackson, whatever. Well, he can say words. He parrot talks a lot. Like, he will repeat things that I say. If I say, Jackson, how was school? He'll go, Jax, how's school?
Mm-hmm.
He doesn't process language in the same way. He doesn't reciprocate nor understand a lot of communication or what words mean. Henceforth, that's where nonverbal autism comes in with him, or minimally verbal autism comes in for him, because he doesn't process language and communication in the same way. He gets very overwhelmed by reciprocating communication. If you try to pull things out of him to try to get him to say certain things, a lot of the times he gets very overwhelmed and frustrated. The interesting thing about my son's diagnosis is that he will not speak in sentences. And if he does, it's very broken in fragments, but he will sing songs. He actually can memorize the lyrics of an entire song, and not just like a nursery rhyme, like actual songs. Like, his latest was Heathens by 21 Pilots. He knows that entire song. I actually, I recorded him singing the whole song, because I didn't know that he actually knew all the lyrics to the song, because he would sing parts of songs. Wow. Like a part here, a part there, just randomly. So I knew he knew the words of the song, but he never collectively sang them all at once. And I actually taught myself how to sing to teach my son how to sing, because at around 1.5, 2 years old, I noticed that music was something that broke through that autism barrier. He was never verbal before music, ever. And I noticed one day that he was humming along to Zombie by the Cranberries. And that was the very first song he actually sang. So I taught myself how to sing to teach my son how to sing. And now we actually sing songs together. And that is our way of communicating now, is we don't have verbal communication, but we will sing songs together. And there's certain songs that he knows, like, what part is his part and what part's my part. And that's our way of not just communicating vocally, but emotionally as well.
Yeah.
So although autism can be very consuming and stressful, and just like I said, like an inception condition, it also has some beautiful sides to it as well. That is one thing that has helped pull me out of almost an autism-induced depression myself, because it was very hard to reach my son for a long time. And music is something that kind of gave us that communication that I've longed for 5.5 years. And like I said, it was actually just this week when I caught him. I actually Facebook Lived it, him singing the entire song, Heathens by 21 Pilots.
I did actually see that.
I cried when I was recording him, because it was just amazing. And honestly, like, I feel like if this country could just focus more on the medical cannabis side of things versus the recreational cannabis side of things in this country, it's like we're all unified, but we're divided. A lot of people are way more focused on recreational cannabis versus medical cannabis. But if we were to focus more on the medical cannabis aspect and how cannabis can be medicinal and so on and so forth, I feel like we would have copious enough amounts of evidence to move marijuana off Schedule 1 by a landslide, honestly. It's a matter of people who need it versus people who want it. And if we could continuously prove that marijuana is medicine, rescheduling and legalization would soon follow suit. And that's just my opinion, I guess, about recreational as well.
Yeah, I mean, I'm all for recreational. That's great. But there's so many people whose lives could be saved or given back to them,
including our kids, because our kids die from autism. Our kids are 2.5 times more likely to die with a life expectancy of 36 years old for severely developmentally disabled people.
Every single time I've found that my son's not there, I expect to find him drowned in water. I really do. I just panic. I try to prepare myself for seeing that, and it's really hard.
People have no idea what it's like to live with that in the back of your mind constantly. Like, some people probably think I'm kind of a crazy person because I talk about autism all the time, but this is why, like, they don't understand what our reality is. I feel like I'm on 24-hour crisis call with my son. Like, I have to have alarms on his window and my door. I have to, like, because he wanders, he'll get up in the middle of the night. Most of the time I sleep on the couch because he'll get up in the middle of the night, and my son can't differentiate between a gallon of juice and a gallon of bleach. And like your child, my son wanders and he doesn't understand concepts like time, danger, fear. So he will run right out into a street with oncoming traffic and not think twice. He doesn't know that he could die, or run right into a body of water like your child. My son loves water, gravitated towards it. It's a stimulus thing with autistic kids because our kids are sensory kids. So they seek comfort when they're overwhelmed. So water is something that's very sensory, stimulatory, and very soothing for a lot of autistic individuals. So that is why our children gravitate towards water. My son does it as well. And even like when he takes baths, I'm like a hawk. I give him his privacy, especially now that he's getting older, and privacy is a huge thing for him because he doesn't understand who's a girl and who's a boy. We're all just people to him. You know what I mean? So like, he's used to me being in there when he's showering and bathing and stuff to check on him. And I kind of have to, as he gets older, like implement a little bit more privacy. But at the same time, it's like, I can't because of his autism. Like, you know what I mean? It's just a double-edged sword. Yeah. Autism is a double-edged sword, but at the same time, without implementing privacy, he just will walk right in on my daughter or me or whatever. You know, he doesn't, like I said, he doesn't understand gender. Yeah. So it's not wrong to him. And Katie knows, you know, she'll just be like, no, Jackson, you know, whatever. But then he gets frustrated because he doesn't understand why he's getting in trouble. He's like, what? Mom checks on me in the shower, you know, like what's wrong with us kind of thing. So, but like 40% of our kids' deaths actually occur in homes or residential like institutions of care. So things like drowning, they don't just happen in a pool or a pond or lake. They can happen in a bathtub. Like, people don't understand exactly what our lives entail and how serious autism really is as a condition. A lot of people don't think of autism as a chronic illness when it is because of how many other conditions autism entails.
My son is the sweetest guy. He's so sweet. He's just turned 10 and he just loves cuddles. He'll come up and wrap his hand around my neck and put his head into my shoulder and just give me like this really cool kind of hug, like just really sweet things. But there's times when that just turns and like his frustration blows up to the point where I have to run away because he is going to gouge at my eyes or bite me or do something like aggressive. And I have concerns about when he starts hitting puberty and these other strengths start coming in as he grows and develops into a young man. I don't know. I mean, is there hope for cannabis to impact Silas in a positive way?
Oh, yeah. Sounds like you're honestly like describing an older version of my son. My son is the sweetest, most loving, sweetest little boy. There was actually a live video that I did a while back when I was talking about pediatric cannabis for autism. I ended up crying in the video, and my son came up and wiped my tears because he knew I was upset. Like, they are very intuitive. They're very like, our kids are such sweet, loving kids, but like your son, my son has that internal autism. And it's not even my son, I feel like, anymore. Like, my son is the sweet, loving, affectionate boy that is Jackson. When autism takes over, he hurts himself. He hurts others. He will hit me. He doesn't understand that he's hurting me. He doesn't understand that he's inflicting pain. And even when he inflicts pain on himself, when he's in severe rages and meltdowns, he doesn't feel it until later on. Like, if he were to organically like stub his toe or something, he will freak out about it. But if he runs face first into a wall in a meltdown, it does not faze him. And my daughter has been a target. I have been a target. It's scary, like you said, and that's one of my biggest fears is my son's 5 and he stands up to here on me. Like, he stands up to my chest. He's really tall and I'm 5 foot tall. I'm short. So, and I'm a single mom. I fear for, like you said, like how is this going to go over when he's older and taller than me? He's already standing up to my chest at 5.5 years old. Like, what happens in a couple of years? Like, what, you know, and my biggest fear is eventually like my daughter resenting Jackson later on in life because she's, you know, very understanding of autism now, but she still has another 9 years before she turns 18. You know, how much worse is it going to get in the meantime? What's going to happen between then and now, you know, kind of thing. That's like really, really worries me. I want to talk about my son's symptoms really quick.
Yeah, sure.
I discovered my son's medical condition in 2016. He was diagnosed with severe low functioning autism. I discovered his symptoms within infancy. I just didn't exactly notice what they were. Like I said, he didn't make eye contact and so on, and he was very withdrawn. His evaluation started very young, about just under a year old, and he was diagnosed when he was 2. My son's symptoms include, but are not limited to, insomnia, bouts of unfocused aggressive behaviors, self-injury, inability to publicly socialize, adherence to repetitive behaviors, gastrointestinal issues, extreme anxiety, pica, which is eating like non-food items or drinking non-consumable items, seizures, inability to understand concepts, like I said, such as time, danger, or fear. And many with autism have underlying medical conditions such as gut and brain inflammation, oxidative stress, autoimmune dysfunction, GABA and glutamide imbalance, mitochondrial disorder, comorbid disorders, encephalopathy, IBS, Crohn's, colitis, seizures, pain, PTSD, TBI, intellectual disability, apraxia, dyspraxia are inherent in diagnosis and may also present themselves as things like sensory processing disorder, sleep, anxiety, feeding disorders, OCD, depression, ADD, and other conditions as well, such as, like I said, behavioral aggression, nonception, and mood disorders. And often, I don't know what your experience is with your autistic child, but a lot of my families, and even I've experienced this myself, when we discuss our children's symptoms to doctors, and often doctors in rural areas are not highly versed or trained in the vastness that is autism. And they write off these comorbid conditions as just autism. Oh, that's just symptoms of autism. That's just symptoms of autism. Do you know how many kids have died because of just autism? A lot. Some of my own families have suffered losses of their children from things like, there was a family that their son died from an autistic seizure. He had seizures, a history of seizures, but they were very sparse, and the doctors never physically saw the seizures happen themselves. The parents would record it. Well, they wrote it off as, oh, well, that's just autism. That's just, comes with the territory of autism. Well, this child had died on Thanksgiving Day from an autistic seizure. He was 8 years old. Another story that came out of Colorado, there's this boy named Creed who died from lack of oxygen in his body, and he would have these very violent meltdowns, and his parents knew that these were not normal meltdowns for him, and they would bring him to the hospital, and they wrote it off as just autism. Well, those are just autistic meltdowns. This child died from lack of oxygen in his body into his brain. So our kids are dying from just autism because their symptoms often get overlooked because of autism being so vast and people not taking it as seriously as they need to. Now, the ironic thing about Creed's story is he was actually being treated towards the end with cannabis, and he was actually able to communicate his symptoms of what he was experiencing much better towards the end. Imagine if he were to be granted access sooner. Would he still be alive? Could he have been able to vocalize more, to say, I can't breathe? Or would the child that had just autism, would their seizures have been under control? Would they still be alive? Would their parents have had to suffer a loss on Thanksgiving Day? And that's just one of many stories that I've run into in my time with Mama. And my biggest fear is me being on the other end of that one day, because of my son's diagnosis is very progressive at this point and scary to know ultimately, if this doesn't pass, what his fate very well could be.
What does his seizures look like?
They started out as silent seizures, to where he would just stare at light fixtures or like ceiling fans, and just, you could not break his attention for anything. And
how long would those last?
It depends. Sometimes a few minutes, sometimes longer. Sometimes it would get to the point where he would stop breathing. He'd fixate so much that he would stop breathing. And those eventually progressed into grand mal seizures, which are convulsive seizures. And Jackson doesn't have seizures often enough, apparently, either, to get diagnosed with seizures. So he still stands with just autism diagnosis. They also suspect that he has Tourette's, but there's a whole, there's not enough.
Yeah.
There is enough evidence with my son's medical history to diagnose him with seizures and Tourette's at this point. But those conditions have stemmed because of autism. It started as just autism, and it has spread into multiple other conditions that are stemming from the autism diagnosis.
The only reason I ask is because sometimes my son does that silent staring off, like he's doing something and then he just like stares off for a second, and it never really lasts longer than like 10 seconds. But there's times when I'm like, are you there? Is something misfiring in your brain right now? And I don't see it a whole lot. I don't see it
Well,
on
that's
a
a good
daily
thing.
basis. Yeah, I know that would definitely be.
With autism, though, like with little things like that, they really make you worry because
Yeah,
you never know
yeah.
what that really is because your child cannot communicate that to you, which is why our kids die from underlying chronic illnesses that get unaddressed. It's terrifying to know that my child could have other medical issues going on that are getting unaddressed because like they get wrote off as it's just autism. That's just autism. No, my son does not have just autism. He also has sensory processing disorder, seizures, and Tourette's because of autism. And that list is growing as he gets older. And it's terrifying.
Yeah.
Because he's 5. And he has to live with more health issues than a lot of adults that I know. And like I said, he's 5, and it just keeps progressing over time and progressing over time and progressing over time. How much worse is he going to be in another 5 years without access? You asked me about evidence that supports medical grade cannabis as a treatment for autism.
Yeah.
There's been studies that have been going on in other more progressive countries. Yes, cannabis is a Schedule 1 in the United States, but it is not in other countries. There's been studies out of Israel, Chile, just to name a couple. The Israel study focused on cannabis for autism in children. So from ages 4 to 22, I believe. It was a study of 53 kids over 66 days that showed improvements in self-injury of up to 67.6%, rage up to 67.6%, hyperactivity to 68.4%, sleep was 71.4%, and anxiety was up 47%. And these were US funded studies that were done in Israel. And they have found that cannabis with varying ratios of CBD and THC, for example, like 20 to 6 can help improve more than 65% of our kids' core behavioral issues, including rage attacks and self-injury, which are a lot of things that cause our kids to have premature mortality rates. So
You said 20 to 6 ratio. Is that like 20 CBD, 6 THC?
6% THC, yep.
Okay.
And the ratios vary. The ratios vary greatly. Autism is inception, and so is cannabis for autism. There's no, because for one, first and foremost, there's no pharmaceutical that can safely or effectively treat the core symptoms of autism. The antipsychotics, risperidone, and Abilify are the only 2 FDA-approved medications for autism, and they only treat the irritability within autism. So all of those comorbid conditions that I listed just a couple minutes ago, they don't touch any of those. They don't touch any of those other conditions. They only treat the irritability within autism. Cannabis helps treat all those other core symptoms. Cannabis has copious amount of documented proof that cannabis can help not just with the irritability in autism, but with the behavioral, social, cognitive, and everything else in between. Sleep, appetite. Autism spectrum disorder is a set of complex neurodevelopmental disorders that are defined by behavioral impairment, social interaction, delayed speech, disordered language, repetitive stereotypical behaviors, restricted ranges of interests. How can medical cannabis help a complex condition like autism? The key is in our endocannabinoid system. And I don't know if you're familiar with what our endocannabinoid system is, but it's the master regulatory system in our body. Every single person walking this earth has an endocannabinoid system naturally in their body. Research implicates that the endocannabinoid system deficiencies are dysregulated within those that have an autism diagnosis. The ECS system represents a network of lipid signaling pathways that regulate many or all that are dysregulated within autism, which ultimately makes positive for helping the core symptoms. Improvements that are documented, like the Israel study that I just went over, are a result of the medicinal effects of cannabis on the underlying conditions of autism. Recent research actually from Stanford University shows that there is a documented deficiency of lower plasma levels of anandamide in individuals with autism. And what anandamide is the endocannabinoid that mimics THC in the body and in the brain. And anandamide plays a crucial role in memory, learning, social functioning, easing anxiety, and so much more. So filling these gaps for our kids that already have these endocannabinoid deficits is crucial. What else is going to fill an endocannabinoid deficit other than cannabis? And that is just kind of the short version as to how cannabis for autism, ultimately why it is such a viable and effective treatment and why it actually treats not just irritability, but all of these other comorbid conditions as well. Like I said, autism is inception. There's so many conditions to manage. That's why you see people on the spectrum, they don't just take one pill to manage their autism unless there's like high functioning. There are some people who probably can, but I don't know personally any autistic individual who's on just one medication to regulate their autism. They're on plethoras of pills. I have a family right now that their child is on 20 different medications to manage their son's autism. This is a child. Our kids with autism are often prescribed varieties of antidepressants, antipsychotics, benzoprines, stimulants, and so on, and off-label, untested combinations to treat their symptoms. And these drugs have serious long-term side effects. And when they're given in combination, the risk of harm increases significantly. Our kids have an average life expectancy of 36 years old. They're 2.5 times more likely to die than the average neurotypical person. The average life expectancy for a neurotypical person, I believe, is 72. That's aside. That's without giving these kids these cocktails of pills. So when you add these cocktails of deadly medications and untested off-label combinations, the risk of harm increases significantly. And this is the safe option that they're pushing for our kids right now. This is what is allowed. I don't understand why it's okay for me to have legal meth in my cupboard to give my son, but not an organic plant. I've been asking this question for years now.
It's really hard. I mean, right now my son only takes 2 medications to help him sleep through the night, and they work 50% of the time. And it's a hard choice because I don't want to give him chemicals. I really don't want to put them into his body. But at the same time, if we don't ever sleep during the night, then we are completely useless as parents. We will die as human beings. We will crash our cars.
And that's one thing, like autism kills our kids in a variety of ways without all of these medications in the mix, like wandering. Suicide's a big one. The high functioning community is 9 times more likely to commit suicide, yet all these antidepressants and antipsychotics are really working, right? Suffocation, asphyxiation. There's so many things that are killing our kids. And all of these are stemming ultimately from autism. There's actually been studies that have been done about the mortality rates for autistic individuals. And during the course of one of the studies that I actually was looking into, the death rate actually increased 7 times for an autistic individual just over the course of that study. And drowning's a big one. Drowning's a big one that takes our kids. And a lot of these things that people don't realize, a lot of these symptoms can be managed better by cannabis. There's studies that actually focal around antipsychotics in the treatment of autism, brain shrinkage with antipsychotics. And if you were to ever look up the black label for risperidone or Abilify, you would see collectively that there are about 200 pages together between the two. And those are the black label warnings for the 2 drugs that they most commonly push for our autistic kids. I have never administered pharmaceuticals to my son. I refuse. I would rather deal with his autism on the front lines than have to worry about side effects and so on and so forth. And I'm not saying anything against anybody who does. Our parents are running out of hope. I totally get where people are. We're running out of options. We're running out of hope. I have to administer melatonin for my son to get him to sleep at night. And honestly, I have to give him more than what I take to get him to sleep. But that is what I have found kind of works like 50% of the time, like you said, to help him sleep at night. So our parents are running out of hope. They're running out of options. And we are being told that these cocktails of pills will help. We'll just give them this, and that, and all these symptoms will just go away, kind of thing. Well, a lot of people don't know a lot about benzoprines. So I'm going to talk about that for just a hot second. Benzoprines are quietly becoming the new opiate crisis within our country. Between 1999 and 2012, benzoprines have killed upwards of 12,000 people via overdose. And these are the kinds of pills that are being prescribed to our kids. Now, what benzoprines are, if you're not familiar, they are a category of drugs that are recommended to people with anxiety and depression and insomnia as well. So essentially, our kids with autism are perfect targets for benzoprines. And benzoprines are drugs like Xanax, Valium, Ativan. Our autistic kids are targets for benzoprines because all of those things that I just listed, insomnia, anxiety, depression, are all symptoms of autism. They're all very prevalent in almost every autistic individual I've ever come across in my life. Benzoprines have a lot of the same characteristic as opiates, addictive properties and characteristics as opiates. So what we're doing is we're unknowingly breeding a new generation of addicts. And then we're wondering why we have all of these opiate crisis and benzoprine crisis that are surfacing in our country. But while the opiate crisis is extremely important, I'm not trying to say in any way, shape, or form that it is not. Benzoprines are quietly becoming the new opiate crisis. It is a silent killer. And not a lot of people are focusing on benzoprines and how scary they really are. And a lot of the doctors who actually prescribe these pills to our kids are not versed enough on the long-term effects that this has on our children's brains. Our children already have a neurological offset via autism because of autism. So administering all of these addictive pills in an already neurologically divergent brain is like playing Russian roulette. And our kids ultimately are the ones who suffer. There, like I said, there's various studies on antipsychotics and treatment of autism, various different studies about all of these pills that they are administering to our kids and what the effects are long term. And not only that, they help contribute to the mortality rate. There are certain side effects like seizures for medicines like risperidone and Abilify, when our children are already 30% higher risk of seizures organically because of autism. Be it the medicine that is supposed to help treat their irritability helps spike seizures. How are you going to keep calm, manage your irritability when you're having a seizure? Induced or partially induced by the medication that is supposed to be helping you. I don't understand. So parents are running out of options. They're getting scared. They're listening to the doctors, the people that they're supposed to trust. These doctors are saying, oh, no, it's okay. You can give them this, it's fine. Well, really what it is people don't want to actually deal with autism. They don't want to actually deal with autism. So they're giving our kids, these untested combinations of pills to pretty much just like put a temporary Band-Aid on a permanent problem. And it is killing our children. It is killing our children. And if it's not killing them, it is breeding addictions within them.
Yeah, I thought we learned a long time ago that you can't just treat the symptoms. You have to actually go after the main problem.
And that's,
I thought we learned that, but I guess not.
A big part of why cannabis is the no-brainer for autism. And we have changed laws and added autism as a qualifying condition in Colorado, Delaware, Georgia, Iowa, Louisiana, Michigan, Minnesota, Missouri, New Mexico, Pennsylvania, Puerto Rico, Rhode Island, Utah, and most recently, Texas is supposed to sign a bill into law this week. Now, that's not it. There are other states that allow autism under debilitating conditions with a doctor's recommendation. So autism isn't exactly a qualifying condition, but they allow doctors to prescribe medical cannabis because autism falls under a debilitating condition. And those states are California, Florida, Maryland, Massachusetts, Oklahoma, Oregon, Washington. Those are all the states that allow autism as a debilitating condition. And we are hoping that Ohio will be the next state to add autism as a qualifying condition. We've actually had a tremendous amount of success stories surfacing as more and more states are allowing our kids access. Families who have had to administer multiple dangerous pills a day are now supplementing with cannabis and weaning their children off of these dangerous pills and freeing their kids from the possibility of a lifelong addiction. Our children are already, like I said, their life expectancy is already cut in half. So what lives they have, why wouldn't you want a better quality of life for your child? I mean, I'm not saying that cannabis is going to cure autism. I'm not preaching cannabis as a cure for autism. There is no cure for autism. But if I can give my son and thousands of other kids a better chance at a better quality of life, then why isn't autism already a qualifying condition? There's a variety of conditions in Ohio that are symptoms of autism that are already qualifying conditions.
But you can't get a diagnosis for those things if you have the autism diagnosis, right? Because then those are just parts of autism.
Not all doctors are this way, but a lot of doctors are that way because, like I said, not a lot of people want to deal with autism. Not even the people who are supposed to be trained to deal with autism. They don't. It's such an inception condition that it's so hard to fully understand. I don't think anybody's ever going to fully understand autism, and that's fine. And people just need to accept that and accept that this is a chronic illness. And instead of trying to, like I said, put a temporary Band-Aid on a permanent problem, find ways to help this epidemic. Because doing nothing does nothing.
Yeah.
Okay, so the conditions that are already qualifying conditions in Ohio that are comorbid conditions of autism are encephalopathy, IBS, Crohn's, colitis, seizures, chronic pain, PTSD, Tourette's, and TBI. Now, if all of those conditions are already qualifying conditions in Ohio, and all of those conditions are comorbid conditions of autism, why is autism not already a qualifying condition?
There's no excuse.
That was one of the biggest focal points of my petition. I submitted almost 500 pages to the Ohio Pharmacy Board at the end of last year.
Thank you for doing that. I was thinking about trying to be that person, and then I looked at everything that was required. I was like, I don't even know where to begin. So I'm super impressed.
I've done years of research on my own, and honestly, I almost wasn't able to submit that petition because I almost died at the end of last year due to a massive tumor that was causing me to have kidney failure. I had to have surgically removed just a week before they started accepting petitions. So through my recovery, I managed to pull off 500 pages and submit it to the pharmacy board.
Wow.
I'm not even close to kidding. October 23rd was my surgery, and they started accepting petitions November 1st through December 31st. So through my recovery is when I pulled off this petition. And I literally beat death to try to save my son's life and yours and thousands of other kids who need this as well, because this is not just for my son. This is not just for my son. My son sparked this inspiration in me to join this movement. However, the biggest reason why, like, people are like, why don't you just move to a legal state or this, that, and the other? Like, I would be abandoning thousands of people who rely on me. I've had people reach out to me from Australia and all over the world, not even just in Ohio, thanking me, like, for doing what I'm doing, saying that they support me. And I'm not doing it for the praise, but that just hit me like a ton of bricks, how many people really are counting on me and how many parents have come forth and said, I want this so much for my child. I'm just not brave enough to advocate for it. You're so brave for putting your face out there and, telling your story. And they are me. I am them. Like, I would be turning my back on essentially myself, I feel like, if I were to move away from Ohio and essentially give up on them. When I look at these individuals, I see myself in them. I see my son and I know their pain and I know what they're going through. And I can't do that because I know exactly what their life is like, because it's my life and it's my daughter's life. And I think about the parents and I think about the siblings and I think about the child diagnosed and the schools and the hospitals and all of the people who are exhausted and overwhelmed from these growing prevalences.
Well, the truth is, it's just not that easy to go and uproot your life and move to another state. Like, I say that, we're going to pick a new state. I mean, that's not a reality for us. Like, we're not literally going to be able to do that.
But that's how desperate our families are, though. It's good that you are honest like that, because that's how desperate our families are. People need to understand that we are at our end, that this is literally a matter of life and death for our children.
Yeah, it really is.
It is. And they don't take it in a serious matter. People don't care until it directly affects them. Well, with the prevalence being 1 in every 59, more projected to be 1 in every 40, this could be you one day. This could be your child, your future child, your grandchild, the child of the spouse that you meet later on in life. This could be you one day. This could directly affect you. And then how will you feel knowing that you did not support it? Would you wish that you had done something differently? I ask people that a lot in public speaking, because like I said, if something doesn't directly affect someone, and it's sad to say in this day and age, then they don't really pay mind to it.
Yeah.
And it shouldn't be like that. It should not be like that. And that is one big reason why I cannot give up on Ohio, because I could move and just whatever and go on with my own life and go to Michigan. Michigan's a legal, state for cannabis for autism. But it's just not enough people care. And I would be no better than anyone else, in my opinion. Even with all the work I've already done, I would still be no better if I did that.
Well, I can appreciate that. I got to tell you, that's not the case. I mean, I don't judge any parent that says, you know what, I'm sorry everybody, but I got to go take care of my kid, and the only place I can do that is in this other state. I have no judgment for those parents either. Like,
don't get me wrong. I mean,
no, I wasn't saying that you were judging them, but
no. Oh, I'm not. I'm definitely not. I tell people to follow your heart. Do what is best for your child.
Yeah.
Any parent would. And that's what I kind of said, backtrack just a little bit about how our parents are becoming desperate and they're running out of options, they're running out of hope. So we're turning to these dangerous pills in hopes that they will help our kids. These pills even leave our kids stagnant. Like, a lot of the times they don't see the results or any kind of significant improvement. And sometimes it even makes the diagnosis worse, because these pills and these side effects spark the meltdowns and everything else to get even more violent and more intense. So it's really a dangerous game you're playing, just even dabbling with pills with kids, especially when you give them the cocktails of pills. But some parents, they don't know what else to do. And I'm not judging anyone in any way, shape, or form at all. Do you know how many different thoughts have crossed through my head on ways to try to help my son? So many. I would do anything to help my child.
Probably close to the same amount to go through my head, I would assume.
That's what I'm saying. Like, you are me, I am you. So when I'm speaking today, even though I'm speaking to you, I feel like I'm literally the voice for the voiceless. Our children need a voice. They need somebody to care. And not enough people actually care, or they'll take something to an extent, and if it doesn't work out or whatever, they'll just drop it and be done. I can't do that, because those are lives of innocent people. And I have a hard enough time at night sleeping knowing my son's reality. And I honestly feel the weight of Ohio. I feel the suffering that's happening in our state. I see it. I feel it. I'm connected to it in more ways than one. And if Ohio isn't granted access, that blood will be on their hands. 44,000 kids in our state are diagnosed with autism. Just the kids. Just kids. 44,000 kids. That is a big number. I don't think people understand what it means if all Ohioans with autism are not granted access. We need whole plant, full spectrum access to medical cannabis with no restriction on age in Ohio. Our kids are dying from a plethora of symptoms and behaviors that are caused by autism. So like I said, families are losing hope and turning to dangerous antipsychotics and benzaprines that also have fatal side effects, which ultimately only increases the mortality rate for our kids. Their life expectancy is 36 versus the general populace at 72. And that is without factoring in these dangerous pharmaceuticals. From things like I said, like wandering, suffocation, asphyxiation, drowning, suicide, seizures, injury, and self-injury. Our kids are 2.5 times more likely to die. The high-functioning community is 9 times more likely to commit suicide. That blood will be on their hands. At the last medical board meeting, Dr. Gary Wink, I don't know if I said his last name properly or not, said recommending medical marijuana to people with autism is the right thing to do, but he has some concerns with recommending it to children. He said, in the long run, they would benefit. However, you're dealing with a very immature brain.
Yeah, I mean, that'd be like my biggest question about using THC on my son. Like, I really wouldn't have much of a hesitation to give him any CBD, but I do know how THC helps CBD in the body. So I'm just like,
if you're only administering CBD versus THC and CBD, you're not going to see the results that I talked about, like in the Israel study or in the Chile study. And keep in mind, for anyone who's hesitant about pediatric cannabis for autism, these studies that I talked about were done on children, done on kids, not on adults, on kids.
So do you have any concern about THC being used on developing brains? Like, what are your thoughts on that?
Under a doctor's recommendation, no. If somebody were to go out there and just do it themselves without guidance or medical intervention, then yeah, because they don't know what they're doing. But under a medical professional, not just a medical professional, but a marijuana specialist, there's doctors who specialize in medical cannabis and in conditions like autism and anxiety and dosing and so on. Under a doctor's recommendation, I do not have any hesitation on giving my son THC. CBD and THC have an entourage effect. They play off of each other. You're not going to see, like I said, the same kind of results versus just giving CBD in comparison to giving THC and CBD. The results are quantifiably different. And a lot of people, they will only administer CBD and not see the same results. But what they don't understand is, like I said, every person with autism is different. They have different symptoms, different conditions that stem from their own specific autism diagnosis. So cannabis is such an interchangeable, versatile medicine that finding ratios that work for each person diagnosed is, like I said, you can't just go in there shooting in the dark and expect, one size fits all, especially for a condition like autism. You have to have a medical specialist to intervene with dosing, especially with anyone. Even with other regulated pharmaceutical pills, you don't see somebody, not everybody has the same exact prescription. You know what I mean? Everybody's different. Like, yeah, this person has insomnia and this person has insomnia, but they have different prescriptions with different doses because they're different individuals. Does that make sense?
Yeah, absolutely.
I'm sorry, I kind of get lost in my words a little bit. So if I kind of run on a little bit, I apologize about that. But it's just, there's so much to it. And I could probably go on for hours on here, but I'm not going to do that to you. But I could go on and on and on and probably make people's heads explode with how much information I have on cannabis for autism and the various different ways that it can help and has helped and will help the future of not just Ohioans, but all people with autism should have access to cannabis. There's 44,000 children diagnosed in Ohio alone. So they're talking about hesitation on pediatric cannabis for autism. Little known fact is they already allow pediatric cannabis in Ohio for other conditions like seizures and Tourette's. So why would our kids be the exception when our kids have seizures and Tourette's and these symptoms that are already allowed for pediatric cannabis. By the time they get old enough to have access, they could be dead. So I don't understand how waiting until they're older will help. I understand the hesitation, but with medical intervention, those concerns can be put to rest. What is the alternative? What about how about the effects that these prescription pills have on our kids' brain, our kids' young brains? How about that? That's what I want to ask.
I'm concerned about that. I mean, one of the medications
Exactly.
my son is on is clonidine, which is a blood pressure medication. And I don't really love giving my kid who doesn't need blood pressure medication. I don't
Exactly.
like doing this.
And that stems dependencies within their bodies over time. The longer that they're on these pills, the more dependent that they're going to become upon them. Cannabis is so much safer and more effective.
It directly interacts with the endocannabinoid system that is causing, or maybe not causing, but at the root of all
the deficits correlate. Yeah. It's mind-blowing to me. Like, if they're concerned about the effects that cannabis has on the young brain, I want them to look up the studies on the brain shrinkage that antipsychotics have in our kids, the mortality rates. I want them to look into that and then compare it to cannabis. And then we'll see what's safer. It's a no-brainer.
So you submitted this petition to the Board of Pharmacy. Have you spoken with them? Have they asked you to testify or anything like that, to ask you questions or anything?
Not yet, but if cannabis is denied, I'm going to look into filing an appeal and going in a court setting and doing whatever I have to do, or going to speak in front of the panel myself. I don't exactly know how that process works. I haven't got there yet. The medical cannabis program is fresh in Ohio. It was just passed in 2016, just became active this year. It was supposed to be active last year. So everything's super new. So if this gets denied, I don't exactly know what the course of action is to file an appeal, but you better believe I will. And any window that they give to apply for, to add qualifying conditions in the future, I will be applying for autism every single time. And I had 500 pages last time. How much more evidence am I going to come with every time that they open this window? It's going to be more and more and more and more and more. And then they're going to get tired of eventually hearing my name and hopefully add autism as a qualifying condition. But I really hope it does not come to that.
If before they made the decision they wanted you to come and talk to them, what would you say?
Well, given the known role of the ECS, the endocannabinoid system, and the documented deficit of anandamide in autistic individuals, it seems entirely possible, if not likely, that cannabinoid-rich botanical extracts from cannabis can be utilized as useful agents for targeting the pathology in autism spectrum disorder, as well as many debilitating symptoms associated with it. We believe that families and physicians should have the authorized right to explore these options without fear of legal repercussions, despite age or severity of the autism diagnosis, including Asperger's and pervasive developmental disorder, because those are also forms of autism. We are parents of children with autism who are interested in legally pursuing medical cannabis as a safe, effective therapeutic treatment option for our chronically ill children. And to that end, we are here to advocate for the legalization of therapeutic cannabis and educate families, doctors, legislators, and the general public about its many benefits. We exist to give help and hope to parents who are interested in its medicinal application. We believe it is our right to legally access this natural plant to its entirety and all of its various medicinal forms. We advocate for qualifying conditions to include the diagnosis of autism and comorbid conditions for qualifying conditions in every state in Ohio. We are not trying to get our kids high. We are not criminals. We are the voice of the voiceless. We are mamas of kids who desperately need help.
Well, Tiffany, I want to thank you so much for your passion, your drive, your mama bear attitude of continuing to fight for not just your kid, but all kids. You got a place in my heart, and I wish I was closer, that my family could help support your family in life situations, but just know that you definitely have our, our spirits are cheering for you.
We're all family. All of us in the autistic community, we're all family. Like I said, when I look at other people's children and I see my son in them, and I know their pain and I know their suffering, and what other medicine besides cannabis has the potential to safely treat the underlying medical conditions as well as the behavioral symptoms in autism? Education is key. Educate yourself, please. Autism is not a one-size-fits-all diagnosis. All of our kids are very unique in their conditions and their symptoms, which is why we need access to safe, versatile, effective treatment options. Cannabis is the safest option for our kids. We want a better quality of life for our Ohio kids. Our kids deserve to have safe legal access to whole plant organic cannabis, regardless of their age or zip code. And if you want more information about Ohio's progress, you can follow Ohio Mama, which is OHMAMMA on Facebook, or visit www.mammausa.org for more information about cannabis for autism. And if anyone wants to reach out to me directly, my email is autismallianceofohio@gmail.com. I'll say it again. It's autismallianceofohio@gmail.com. Please feel free to reach out to me with any questions or concerns, or even just to talk. If you didn't know that we existed and you're just discovering us now, we are here. We are advocating for your kids, and we are going to do everything in our power to give Ohio access.
Thank you so much. Is there anything else you want to say to our listeners who are considering cannabis today?
I just want them to educate themselves, honestly. Education, like I said, is key. Don't turn a blind eye because it does not affect you. You don't have to be tied to the autism community to advocate for this cause. Think about the thousands of people that this affects. And that's just in Ohio, the statistics I was giving. There's millions of people in this country that this affects. Please support MAMA, not just Ohio's chapter, but MAMA USA in general. We are a grassroots nonprofit organization. We put our own blood, sweat, tears, time, and money into this. We want a better quality of life for our kids and for others. We want other parents to tell their story. Tell your story about your experience with autism, whether or not you've experienced anything with pharmaceuticals, or like me, I have not used pharmaceuticals on my son. Tell your truth. Speak your stories. Tell about what interventions you've tried, what has and hasn't worked. People need to hear our truth. They need to hear our story. They need to hear our reality. And if you come from a legal state, share your success story. Please share it with Mama. Share it with anyone. This needs to be a nationwide movement. I just live in Ohio. I wish I could advocate on a national level. I really do. But taking on Ohio has been quite the challenge in itself. But I would do it again if I have to. And I want to encourage others to find their voice to do the same. Inquire if there is even a chapter in your state. If you're out of state listening to this, is there a chapter in your state? Can you maybe help start a chapter in your state, or can you help involve yourself with the state chapter, whether it's Ohio or any of the state chapters that are active? Do your part. Be a good person. You don't have to be tied to autism to be the change that you want to see.
All right, Tiffany, thank you so much for taking the time to join us today.
No problem. Thank you so much for having me. I appreciate it. And thank you for listening and for telling me about your child and your experience. And I'd honestly like to talk to you further. It's not the last that people are going to be seeing of me, even if autism is added as a qualifying condition. I'm going to be, the pharmacy board's going to love me.
Well, I do. I certainly do appreciate all the work you do as well. Yeah, thank you.
No problem.
This conversation really made me take a sober look at my son, the severity of his symptoms, the medications he's already taken at 10 years old, how much he understands versus how much I think he understands, what his life will look like when I'm gone, or what mine might look like if he goes first. I never really thought about the life expectancy of kids with special needs or disabilities or severe disabilities, and I honestly don't know where Silas's ranking on the spectrum correlates to the life expectancies, and honestly, I don't really want to get too much into that. Can you blame me? You know, autism isn't something that we can just ignore, and we owe it to our kids to try everything that others have had success with. Now, I mean, I'm not saying that it's going to be right for everyone. Every parent needs to consider the options and the risks and benefits of all the options out there, but shouldn't we get a say in that? Now, if you'd like to help the autistic community gain access, please go to considercannabisnow.com. On the homepage, under the player for this episode, you will find the emails of the members of the Ohio Board of Pharmacy and a suggested template from Mama to send to each of them. Now, please feel free to personalize it, share your story, share your struggles, speak from the heart, but please be respectful. Remember that these government officials are people who probably feel some gravity to this decision. And if you happen to be one of those members of the board somehow listening to this, from the bottom of my heart, please allow us the opportunity to pursue this treatment in a manner that will not jeopardize the custody of our children. That's all the time we have. Please remember, go to considercannabisnow.com and send an email to help us gain access. And for more ways to help Mama and how to get involved, go to mamausa.org.
If you would like to be a guest and share how cannabis has helped your health and wellness, contact us at considercannabisnow.com. If you found anything of value in this episode, please share it with someone else. Remember to subscribe for free and get every new episode delivered right to your phone. Join us next time as we consider cannabis together.